Well, good afternoon, everybody. It is October 12th at 4 o'clock. Hi and welcome. My name is Casey Boland, and I'm a wealth advisor and partner here with HCM Wealth Advisors. Welcome to our webinar. I'm joined today by a special guest, Gordon Loudon with RetireMed. Gordon is the manager of business development at RetireMed and has over 7 years experience in the Medicare space as a licensed agent. And RetireMed has been a great resource for HCM we can turn to in helping our clients seek help in navigating the Medicare landscape, help in finding a plan that suits our clients' needs. So thank you, Gordon, to you, your team for helping our clients. Quick housekeeping. If you'd like to ask a question, please go to the bottom of your screen and click on Q&A, and there you'll have an opportunity to submit your question, and we will do our best to answer at the end of the webinar. So, all right, Gordon, just this morning, news broke that Social Security recipients are going to receive a 3.2% cost of living adjustment coming up here in 2024. And that 3.2% figure, it steals the news headline. So was the projected Medicare premium increase for 2024, was that a part of the news report?
It was. So it was a projection was announced, and I always hesitate a little bit because those things can change on the Medicare side until it's the official announcement from CMS. Though there was a portion of that announcement that was the projected Part B premium. Early reports as of today are showing that might be about a $10 a month increase. So we'll talk about that a little bit more. But currently, that base rate for the Part B premium is $164.90 per month per person, looking like that might increase in the neighborhood of about $10 a month.
Okay, well, that's not too bad of a sting.
Not too
So
bad. Not too
we've
bad.
seen worse. Certainly,
Certainly.
we were spoiled last year after the reduction, but certainly that followed a pretty substantial increase the year before. So, Gordon, I'm going to hand it off to you here in a moment. Gordon's going to have a little something for everybody today in the presentation, whether you're retiring early, before Medicare age, before 65, or about to become 65, and yes, you're getting ready to retire, or if you're continuing to work or already on Medicare. So Gordon will have something to share for all. So Gordon, again, thank you to you, the RetireMed team, for being a valuable resource to HCM and thousands here in the tri-state area. So I'm going to hand it off to you to get started. And if I pop in, it may be to interject a question, but I'll let you roll. And again, appreciate your help.
Perfect. Well, thanks, Casey, for the introduction. We love working with HCM clients, as well as just so many other people in the community. So we'll go ahead and dive in here. I've got a few agenda items that we'll cover first here. Really just going to start in with some introduction on RetireMed, so anybody that's unfamiliar can have an initial level of familiarity with us. Then we're going to dive right into the Medicare basics. The A's, B's, C's, and D's that you hear about all the time. Some of you may be more familiar with those already than others. We'll talk about transitioning to Medicare, how somebody joins for the first time. We'll talk about some considerations for those that are going to be planning to work past age 65 and having options with employer plans, Medicare, things like that. We'll talk a little bit about the annual enrollment period that we're getting into here just in a few days, starting October 15th for those that are already on Medicare, sort of what that means, some considerations for that group of folks. And then a little bit more about RetireMed, some takeaways, how to get in touch with us for anybody that's interested in learning a little bit more. So first off, RetireMed in general, we are primarily a Medicare consulting service. We're actually headquartered up in the Dayton area. That's where I'm sitting right now. We have another location physically down in the Blue Ash area of Cincinnati. But we meet with folks via phone, via Zoom, in person if they have proximity to our office location. Really want to meet people where they are and give that help, give that advice. Best thing about RetireMed as it pertains to Medicare advice and help with those plans is that our services are completely no cost to you guys and to anybody that reaches out to us seeking that Medicare help. And that should have the lights blinking a little bit as far as how do we do that? How is that permissible or how do we operate as a company under that function? And really it's because we get compensated by all of the various insurance companies that we represent. So for example, we work with all the major carriers across the states, our states, which are Ohio, Indiana, and Kentucky, which I have on the next slide. as well as a lot of the smaller carriers as well. We're really trying to find through a research process what plan works best for that individual based on, your individual doctors, your medications, needs, budget, things that you want out of a health plan that you may have heard about or haven't heard about, and so on and so forth. So we really take that personal approach to get to know you, very similar to how HCM does it on the wealth management side, to really make sure you're in a good spot as far as Medicare goes. Down here at the bottom, I just outlined a little bit about what Casey referenced as far as how our segments work. We do some what we call the pre-Medicare or individual health plan advice for those that are age 50 plus and maybe retiring early if they're in a situation to do so and need to look at those marketplace plans or compared to a COBRA option. We also help those that are 65 plus and retiring, meaning that they need to look at Medicare as an option because they no longer have coverage through their employer or anything else as their healthcare solution. And of course, those that are 65 plus and continuing to work, this is something that we deal a lot with year round for those that do or maintain rather that health coverage option through their employer. Our advisors do a great job of looking at that option through the employer, looking at the options through the Medicare space, and being able to make you a strong recommendation as far as should you stay on that group coverage or should you move to Medicare if it's going to be more cost effective for you, to really try and dial in that optimal time to make the switch if you haven't already. And then finally, those already on Medicare. I'm sure we have some of those on those folks, on the call today. A couple of considerations that I'll share toward the end as well about what those folks should be thinking about this time of year as far as plan options and potential changes are concerned. Mentioned that already. We are Ohio, Indiana, and Kentucky. If anybody is on this call that's outside of that area or has friends, family, etc., that's outside of that area, we are happy to give a referral to more of a call center based company that can service nationwide as needed. We're happy to give general advice because Medicare is a federal program. So really everything I say in this presentation today is going to be applicable nationwide, given it's that federal program. But for actual full enrollment services down to the specific plan and support, we are limited to these 3 states. So I just want to make everybody aware of that. All right. So diving right in, what is Medicare? So Medicare, for those unaware, is a federal health insurance program administered by CMS. It is primarily for those 65 and older. That's that magic Medicare age that we hear about a lot. But it's not the only age that can give somebody Medicare access. If somebody is disabled per the government's terms and on Social Security disability, they too get Medicare eligibility after a 24-month waiting period. Similarly, any age individual that is diagnosed with either end-stage renal disease or ALS also becomes Medicare eligible, and those specific conditions do waive that 24-month waiting period. So anybody with those conditions would get immediate access to Medicare as well, again, regardless of age. So Medicare today, we're going to get right into the basics. As I mentioned before, the A's and B's and C's and D's that we hear about through all kinds of advertisements, all kinds of news. It's a hot topic all the time. I'm going to keep it as high level as possible, give some good information. The nice thing about A and B in general and an original Medicare is that when somebody gets to an actual plan, a lot of those things about A and B are sort of not in play, and they start following the terms of their plan. So we'll talk more about that later as well. But first of all, you've got A and B. That is what's commonly referred to as original Medicare. Then we'll talk about Medicare Advantage plans and Medicare supplements as your 2 general styles of plan options, as well as prescription coverage, which is commonly referred to as Part D, as in drug coverage. The important reason that anybody on Medicare or looking to join Medicare should work with an advisor like RetireMed or someone similar is that there are a ton of options. In Ohio alone, there are 200, or rather more than 200 plan options to choose from. And when you get all this mail and information from carriers directly, they are all marketing, right? It's all advertisements. Every carrier is going to try and make their plan look really good on paper. And you really need somebody that works across the board with these different plans to help kind of slice and dice and sift through those different options to ensure you're finding one that actually fits you as an individual versus trying to fit in, potentially a box that a specific captive carrier is trying to fit you into. Wanted to pull up a quick example of a Medicare card. Again, some people may have this already. It's commonly referred to as the red, white, and blue card. For whatever reason, the government still prints these on paper. It's a paper card that you get when you go on to Medicare, which of course gets tarnished over time. We see a lot of people end up laminating them to protect them a little bit. But this is what people are talking about when they refer to their red, white, and blue card, or somebody asks you about that red, white, and blue card. All right. First up is Medicare Part A of Original Medicare. So Part A does not have a monthly cost associated with it for most people. Reason being, this is the portion of Medicare that we've all generally paid into through our payroll taxes, those FICA taxes over the years. Once somebody pays those Medicare taxes for 40 quarters or 10 years, they become entitled to Medicare Part A, meaning they can get it upon Medicare eligibility at no monthly cost. Part A is generally related to hospital services specifically. So what that means is I'm talking about inpatient hospital, when somebody's actually admitted to the hospital, as opposed to those ancillary outpatient services that we'll talk about later. The really main cost with Medicare Part A is a deductible. And what's a little funky about this deductible that I don't want anybody to get too hung up on is that it goes by what's called a benefit period as opposed to an annual deductible period. So most insurances that people on this call have or have had in the past deal with annual deductibles most of the time. Medicare's benefit period deductible that they assign to this Part A benefit really just means that if somebody was to go into the hospital and use a Part A service, they would be hit with that $1,600 deductible if they didn't have any other supplemental or Medicare Advantage plan at play. And then that deductible basically keeps them covered until they're out of the hospital for 60 days. If somebody leaves the hospital, they're gone for 60 days, and then they go back, they would actually start a new benefit period, as they call it, and be hit with that $1,600 deductible again. So that's a problem. First of all, that could get costly if somebody was in and out and potentially hitting that more than once in a given calendar year. Definitely ways to avoid that through plans and make it a lot more cost effective for hospital services on the Medicare side. Part B, on the other hand, is the portion of Medicare that's more focused on the medical and outpatient and doctor services. So non-hospital admittance, these are your primary care visits, your specialist visits, your screenings, your outpatient tests, procedures that are done throughout the year potentially. And this is the portion of Medicare that has a monthly premium associated with it. So as we mentioned earlier at the beginning, for 2023, that figure is $164.90 per month. An interesting thing about that figure is that it is income driven. So that's the base rate. Those that make more could be paying more for Part B. And that's always a question that we ask at RetireMed. We want to know filing status on taxes, and we want to know income, because it's generally, as a rule, a 2-year look back. And for an individual filing a tax return, that income threshold is $97,000. And for a couple that filed joint, it's $194,000. So being under that means you get the base rate. If you're over that, you could be charged more. Now, there are opportunities to potentially appeal that an advisor can certainly talk more specifically about with anybody that's curious. Main reason for an appeal might be like retirement. I've stopped working, or I've gone part-time and my income's reduced. And the whole goal with the potential appeal is to have the government take a more current look at an individual's income to drive that Part B premium, as opposed to looking 2 years back when income may have been higher and would normally be designating a higher premium for the current year. All right, other costs associated with Part B is that there is an annual deductible on this one of $226, so pretty low as far as deductibles are concerned. And then after that deductible, it works as an 80-20 system, meaning that the government's going to pick up 80% of the amount on those Part B services, and you, the individual, if you had just original Medicare A and B, you would be responsible for that 20%. Last note on here is about payment for Part B. So those that are drawing Social Security or Railroad Retirement benefits are going to have this Part B premium automatically deducted from that benefit amount. If anybody joins Part B and is not yet drawing Social Security or isn't eligible for it or anything else, the default is that the government bills you on a quarterly basis by mail. So 3 months at a time. It is possible to set up something called Medicare Easy Pay, where you pay that on more of a monthly basis, but the default is quarterly, and they send that bill right away in the mail. So continuing on to that 20% comment that Part B has, I like to share this slide that says Medicare was never intended to cover 100% of the costs, frankly, because it wasn't. And the big issue with that 20% and those benefit periods on Part A is that it comes with a lot of risk potentially. So most plans that anybody would be on through an employer, or if they're already on a Medicare plan, it's going to have generally something called a maximum out-of-pocket limit. Original Medicare Part A and Part B by itself does not have an out-of-pocket limit. And so what that means is that if somebody, God forbid, had a catastrophic year and they just had A and B, that 20% can just keep going and going and going without any sort of point of relief. And that's really where plans come into play. So I'll use this graphic pretty briefly. This is a chart that, or a visual rather, that our advisors use in their one-on-one meetings with clients to really make people understand that Medicare should be a two-step process, and we view it as a two-step process, meaning that step one, getting that original Medicare A and B, is really more of a prerequisite to getting a plan than full Medicare coverage in and of itself. And then you get into step two once you have that A and B, and that's where you have the selection of the Medicare Advantage plans versus the Medicare Supplement plans, which I'll expand on here in the coming slides. Right. And before I do that, there are some individuals that might have sort of an option 3 down there in step 2, which could be a retiree plan. So you like Procter & Gamble comes to mind in the Cincinnati area. They offer a Medicare Advantage plan that's a group retiree plan. We're able to compare and contrast that to options through the private market as well. There's some other large corporations, or maybe somebody worked for a government agency or a federal retiree. There are other plan options that some people might have available to them. We maintain familiarity with all of those as well to make sure we're pointing people in the right direction and giving good recommendations. Okay. Starting off with Medicare Advantage. So these are also referred to as Part C plans, C like combination. You might hear that as a buzzword. Medicare Advantage plans, MA plans, MAPD plans are all synonymous for these types of plans. These are the ones that you see the most advertisements about. You see the zeros all over the TV screens and in mailers that you get. They are not too good to be true, but again, you have to be cognizant that when the carriers are advertising, they're only picking out their best figures, right? And so when working with an advisor to really look into the nitty-gritty of these plans, it's important to know what other costs and other benefits are underlying in these plans. But they are very strong plans overall. They generally have $0 premiums, although some of them might have a small premium on a monthly basis associated with them, which would be in addition to that Part B premium of the $164.90. They do have networks attached to them, which frankly used to be more of a scary type thing. Networks had a lot more volatility. We've noted a lot more stability with networks over the past 5 to 10 years even, where these carriers are recognizing that people don't want to be limited in the care that they're seeking, and they're doing a lot better job of contracting with hospitals. Certainly, we still see some things in the market and contracting issues come up. And it's something that we always monitor to see if any of our clients might need to change their plan. We communicate about that. But as a general statement, we're typically able to find plan options that do encompass multiple hospital systems, multiple states even, some networks even nationwide, to really ensure that somebody's having access to the providers that they want to have access to. These are also the plans that have a lot of what I call the shiny benefits of Medicare. So we're talking about maybe some dental, vision, hearing coverage, silver sneakers on a lot of these plans, which is a fitness benefit. over the counter for all those things we buy at pharmacies that aren't necessarily a prescription medication, and other supplies. They come with a lot of these ancillary benefits that these insurance companies that offer the plans are actually adding to year after year and making them more benefit rich to try and keep a competitive edge over some of the other of their competitors. Okay, Medicare Advantage plans are convenient in the sense that when you are enrolled on one, you really have one card that you have to use. So you still have that red, white, and blue card, but it can essentially be filed away, because what these plans are doing is they're combining Part A hospital, Part B medical, and Part D prescription drug coverage, and they're wrapping it all into one, combining it all into one, through that private insurance carrier. Therefore, when you go to the doctor, the hospital, the pharmacy, and likely the dentist or vision provider, you're just showing them that one Medicare Advantage card, and all of your billing and claims goes through that private insurance carrier that you select your plan with. Moving on to Medicare Supplement or Medigap plans. These work a little bit differently. So instead of being a combination of Part A and B and D and having some extra benefits, this is more of the traditional secondary insurance to Medicare. So I mentioned earlier that Part A and B by itself has some deductibles. It's mainly an 80-20 system after that. What a supplement plan does is essentially covers that 20% in most scenarios. So you've got Medicare primary A and B. You purchase an additional plan, which would be a Medicare supplement plan, to pay that 20%, and you are left with 100% coverage. And on most supplement plans, not having copays throughout the year as a general statement. There's a little bit of variation based on letter between like a plan F, a plan G, a plan N, and so on. But most of them are going to have very little, if any, copays throughout the year as you use medical services. The other pro of these is that there is no network restriction. So as long as you're going anywhere in the United States that accepts Medicare, original Medicare in general, you're going to also have your Medicare supplement plan accepted there to maintain that 100% coverage. They do not have as many shiny benefits as something like a Medicare Advantage plan would have. They're a little bit more bare boned. They sometimes have a fitness benefit or maybe some discount programs, but nothing super tangible as far as extra dental, extra vision, things like that, which people can get an additional policy for if they choose to. But Medicare itself on the basic level does not cover things like dental, vision, hearing, which of course become more and more important as individuals age. With a Medicare supplement plan, the other thing that they do not cover, or do not have built in rather, is prescription drug coverage. So everybody needs to have prescription drug coverage once on Medicare, or else the government's going to penalize you for that later. And the main way to achieve that with a Medicare supplement plan, or really the only way to achieve that with a Medicare supplement plan, is to purchase an additional plan, which is a Part D prescription drug plan on a standalone basis. And so to visualize that a little bit, and again, these are also offered by private insurance companies. It's a pretty simple research process where we look at what medications you have, and it really kind of provides us a list of the plan options available to you based on your county, sorted by cost or an estimated cost based on your current prescriptions. But to visualize this route a little bit from a card perspective, these individuals do carry 3 insurance cards to kind of make everything work here. They would have their original Medicare red, white, and blue card that we saw earlier. That's going to be their primary hospital and medical insurance. They would then carry their supplement card that they purchased through a private insurance carrier, which, by the way, just to ballpark that for anybody curious, an individual that is joining Medicare, let's say just at age 65 and chooses a supplement plan, they're going to be in the $120 to $150 per month range with most carriers to start. So you'd have that card as well. That's your secondary hospital and medical coverage, picking up what your red, white, and blue card does not. And then when you go to the pharmacy to pick up medications or get them through the mail order or what have you, you would have that third card for the standalone prescription drug plan as well. All right, a few things to think about when making the transition to Medicare. First one being is that Medicare is not a one size fits all. And so I can't say it enough. I mentioned it earlier that we really like to get to know our clients on a more personal level, to really understand what their needs are, what their wants are out of a Medicare plan. What does utilization look like? What does the budget look like? Where do those sorts of things come into play? And again, when you see the advertisements from carriers specifically, of course, everything looks good and they're making it seem like it fits everybody, but we are pretty passionate about wanting people to keep their doctors, keep their medications, really have continuity from whatever other coverage they may have had before, and more interested in finding new and additional benefits as opposed to telling people they might need to change something around just to make a certain plan work. So working with all these different options really enables us to do that. All right, I want to talk a bit about applying for Medicare for anybody that's not on it already. I have basically 3 different scenarios that I'll walk through. So if somebody is drawing the financial benefit through either Social Security or Railroad Retirement Board prior to age 65, prior to that Medicare eligibility, that enrollment in Medicare is going to be completely automatic. About 3 or 4 months before your 65th birthday month, that Medicare red, white, and blue card is just going to show up in the mail. It's important to know because if you're somebody that's working past 65, you meet with an advisor and they say, hey, your group insurance through the employer is actually better for reasons A, B, and C. You may want to defer that Medicare Part B and essentially send that card back and wait till a later time on Medicare. And you would have to do that proactively if you're drawing Social Security. Others that are turning 65 and not drawing that financial benefit through Social Security, there is no automatic enrollment. You would have to proactively apply online for that Medicare A and B. The time that somebody could do that is a 7-month window called your IEP or initial enrollment period surrounding that 65th birthday month. And the easiest way is applying online at socialsecurity.gov. And again, Social Security will do their thing and they'll shoot out that Medicare red, white, and blue card to you in the mail once you submit that online application. For the folks in the third bucket here that are waiting until after age 65 to join Medicare, because maybe they were in that group that it made sense to stay on the group coverage, again, for whatever reason, you actually trigger what's called a special enrollment period or SEP whenever you decide to enroll in Medicare. So somebody with coverage through their employer based on active employment is able to essentially join Part B and A whenever they choose to, just by virtue of either having employer group coverage or leaving employer group coverage. From a timing standpoint, so if people know, it's a really good idea to start this process about 2 to 3 months prior to your Medicare effective date that you and your advisor have figured out and determined together. That just allows time to get any extra paperwork that's needed. There are a couple of forms that we always provide folks in this bucket that the employer has to fill out to show, yep, John Smith here had coverage through company ABC since 65. So that's telling the government 2 things. A, John Smith's allowed to enroll on Medicare right now, even though it's might be mid-year. And B, don't charge John Smith any sort of penalty for joining Medicare late because he's had this other coverage. On that note, for those beyond 65, I always love to call out that retirement is not a requirement for Medicare. We run into folks probably about every day that really pair these 2 together. And sometimes, or it could be the same date. You could go on Medicare as soon as you retire. But again, we really, really, really encourage people to actually compare their options at that initial eligibility or anytime really that they're working past 65 to figure out if you could be getting better benefits at less money, maybe saving on prescriptions, maybe, just being in a better spot from a health insurance standpoint. I always say it's worth the due diligence to take an hour or so to talk through it with an advisor and compare. Want to expand a little bit on employer coverage versus Medicare. These are just the general considerations that our advisors work through Again, it gets much more specific on an individual basis, but when we're doing that comparison for anybody that may be in that group, we're of course looking at the premium and deductible of the plan that might be offered through their employer. We're looking at what type of plan that is. Is it a high deductible? Does it have a health savings account? Is it what's called creditable to Medicare, meaning you can stay on it without penalty past 65? With the HSA, contributions and Medicare don't mix. So if you have any part of Medicare like A or B, you cannot contribute to a health savings account. So we want to be aware of those things to determine, all right, are you staying on group? Do you want to maintain eligibility for the health savings account or not? And is that even a factor for the individual? Income, certainly, I mentioned that briefly earlier. That comes into play for the Part B and Part D premiums. The government does have these really just surcharges that they would charge to somebody that was a higher income earner by their standards. Another thing I like to just acknowledge on the income is that while it is a 2-year look back, I talked about appealing earlier, but it's a constant 2-year look back. So some folks that get that IRMA maybe to start and can't appeal it for whatever reason often feel like they might be locked in with that cost for the foreseeable future, forever potentially, and that is not necessarily the case. If income is gradually going down or gets below that threshold over time, it would naturally reduce your Part B premium. If somebody is consistently having much higher income for the government's thresholds and charts, then it wouldn't go down if there was no reason to appeal. And yes, that means that individual would be continuously paying a higher cost than others for Medicare. And a good problem to have, I suppose, but it's definitely something to be aware of from a planning standpoint. And that's where we can really come into play as well, really kind of in partnership with your financial advisor to help plan for those costs for the future. Dependents play a part as well. Maybe if I'm an individual that just turned 65, Medicare could look really good for me as opposed to my employer plan. But if I have a younger spouse or children on that plan that don't have any other coverage options, maybe I ought to just stay on my group insurance to keep them covered for however long that might be. So that's certainly a consideration. And then health factors in general. What are those utilization rates for the individual? Do they have any chronic conditions? If so, are they very high cost ones that might require lots of services throughout the year? The prescriptions come in, again, is it more generic medications? Are there some pricey brand ones in there that might be shifting costs a little bit? We really want to take that whole holistic approach to find out which is going to be the stronger option. Won't spend too much time on these next two slides. They talk about, do I need Part A in employer coverage? And the next one is, do I need Part B in employer coverage? I will preface this all by saying, generally speaking, Part A is okay to have when you have employer coverage and are staying on employer coverage. But the number one reason that you would not want to have Part A in employer coverage is what I mentioned just a couple minutes ago. It would be the presence of a health savings account that you or your employer is still wanting to contribute to. When somebody applies for Medicare down the road, if they're over 65, there is going to be Part A is going to go 6 months back from the date you apply for that Medicare. And so there are certainly considerations there as far as when contributions to a health savings account need to stop. That can prorate your annual contribution limit in that year that you're joining Medicare. And that's, again, something that your advisor can absolutely talk you through a little bit more to make sure you're not getting any penalties or strange situations. I do call out that Part A comes if somebody's drawing any sort of Social Security. So you cannot draw Social Security and not have at least Part A. They will give it to you automatically and they won't let you get rid of it, which means that would also make somebody ineligible to contribute to a health savings account. If there's no HSA in play and you don't foresee there to be one in play and you're staying on group coverage for whatever reason past age 65, you can have Part A. It doesn't cost anything. You'll hear that from a lot of people. Just get it. It's free. It'll be kind of in the background and coordinate with your group coverage if you get into those inpatient hospital services. Really no issue. It's really only a decision if you have a health savings account in play. On the Part B side, it does matter your employer size. Do you have less than 20 employees at your employer? That means that you don't actually even have the option of staying on your group coverage without Medicare. You have to get Medicare Part A and B right away because it becomes your primary insurance if you're at an employer of less than 20 employees. If your employer is greater than 20 employees, which most do, you do have the option to defer. But again, that's where we would come in and help you compare, make a recommendation. Just because you can stay doesn't mean you should, but it's certainly possible that that's the right move. I'll also add that there really isn't any scenario, in my opinion, where somebody should have both A and B and employer coverage. If you're going to get Part B and start paying that monthly premium for it, I absolutely recommend being fully on Medicare. And if you aren't going to be fully on Medicare and you're going to keep your employer insurance, there's really no reason 99+% of the time to have Part B alongside with it. You should really be on the employer side or on the Medicare side, but not be premium heavy and paying for both. All right. So talking about the annual enrollment period. So this is a period that runs October 15th through December 7th each year. That is why if anybody is in that sort of 65+ age range or close to it, your phone's ringing, you're getting more in the mailbox. Every time you turn on the TV or the radio, it's another Medicare commercial. Everybody ramps up advertising this time of year because it is the time that these insurance companies can target everybody on Medicare and try and encourage them to get on whatever their plan offering is. So again, being aware that those are advertisements and it's important to sift through them. The real reason for this time frame is to compare options, it's to make changes, and that's something that we absolutely can help with. We run into scenarios every day during this time period, year after year, where it could be somebody that maybe they've only been on Medicare for a year or less, and a new plan in the next year, 2024, might save them significant dollars. Or we might say, hey, you're actually already on the right plan. You're in a good spot. We don't recommend a change. Just keep doing what you're doing. And then others that may have been on Medicare for several years and haven't really evaluated it for several years. They've been kind of comfortable enough and really just haven't taken action on changing. Again, same result. It could be, you're right. Your plan is still good. Keep doing what you're doing. But those are the ones where we often find some really significant savings sometimes of just between new plan options coming out throughout the year, their current plan changing. We've seen a lot of kind of trending activity where those on the Medicare supplement style of plans, their premiums have gotten so outrageous that they're just frankly not affordable anymore, and it becomes a math problem at that point. Would I be better off on a Medicare Advantage plan? Could I find a different Medicare supplement plan through a different insurance carrier that I might get accepted for and could save me money? And sometimes it's just as simple as a single prescription. We've seen instances where a certain plan might have a prescription on a really high tier, making it a much higher copay. And a different plan is very similar across the board on other benefits, but it might have that particular prescription at a tier 1 or a tier 2 that's going to immediately save that individual additional dollars just by going through that motion of comparing. From a just retire med standpoint in general, I always like to say that it is more than a plan, it is a partnership. What really makes us different is that we provide lifelong support for anybody that is on a plan through us. So we are like anti-transactional experience. We really want to get to know people, and we don't want to say, all right, great, you've got a plan, see you later. We don't want to say, if you have an issue, you need to just call the number on the back of your ID card, because we all know how that goes dealing with insurance companies. We employ an entire team here called our client advisor team, and their entire purpose is to be available year-round to anybody that is, on a plan through us, to help with things like billing issues or just plan questions, how to use it. It's a lot of information. We make it as digestible as possible at that initial enrollment, but your advisor might tell you about some dental or some vision or a fitness benefit or a meal card, a food card, whatever. and you kind of leave that meeting feeling like, wow, I have a lot of benefits coming through my Medicare plan. And a couple months later, you go to use it and it's like, well, I know they told me about that, but how does that actually work? How do I access that benefit? That is what this team is here for. From a communication standpoint, we really stay up to date on things happening in the marketplace, in the community that might affect Medicare, that might maybe a network disruption that could drive the potential for a plan change. And of course, just the general year over year comparison. Number one call we get during this time period from our current clients is, I actually like my plan, but do I need to do anything to keep it, or should I be switching? And we do just tons and tons and tons of those appointments with our current clients year after year, just to give them that peace of mind that, hey, you are on the right plan still, or no, thanks for reaching out. We actually think we could save you X dollars, or you could gain more of this benefit that you're interested in if you looked at a, Anthem instead of a Humana, or an Aetna instead of a United Healthcare, or a Medigold, or whatever the carrier might end up being. Again, it is just important to see what's out there and see if you could be doing better or if you're in the right spot. And I think I mentioned earlier, we do offer in-person meetings for anybody that is within driving distance to our Blue Ash office or our Dayton office, which is in the Miamisburg area for anyone familiar. But we are all about meeting people where they are. We do a ton, if just as much really, either over the phone, just a basic phone call meeting, as well as the Zoom video calls, just like we're doing right now.
Good, Gordon. I'm curious. Sometimes it's helpful to help a family member. And do you guys work with family members alongside with the member that with their plan? And how do people operate with you in that fashion?
Great question. I'll give you an example. Actually, from this time last year, I had there was actually a cancellation. So I was managing our advisors at the time. There was a cancellation. I needed to step in and cover an appointment for that advisor that was sick that day. I can do so. I'm licensed. I used to be in that role. So I stepped in instead of having to reschedule them. And it was for a woman that was bringing her dad in. And she brings her dad in. We get him set up with a plan. He was not on Medicare yet. He was brand new to Medicare, but was very confused. She needed that help. And in the middle of that meeting, she starts telling me about, I think you could really help my mother-in-law and my father-in-law. And also my mom, she's been on Medicare for a few years now. And over the course of the next week, she actually brought them in one by one. She could have brought them in as a group if they wanted to, but they all wanted their own appointment, which fine. And she brought them in one by one, and we were able to actually find them all a stronger option. Again, sometimes they're already on the right option, but we were saving, half her family money. And so I do just encourage everybody on this call to think about, who do you know that's already on Medicare, whether it's yourself or others, and we're happy to help them too. So if you're somebody that's in a caregiver role or even have a caregiver, we'll work with them. We'll work with you together. If it's a power of attorney situation, we get that paperwork as well and go from there. But aunts, uncles, friends, neighbors, we love getting connected with the helpful people that are going to connect us to the individual that might not be seeking out the help themselves, and really bringing that all together to make sure that everybody we can talk to is in a good spot.
Great. Well, I didn't mean to interrupt your presentation, so I didn't know if you
Great
were
question.
kind of winding up or if you had a little bit more that you wanted to share.
I am very close. I have a couple more slides here. I just wanted to call out, we do have something that we call the Pathfinder, which is really just our monthly newsletter. We're education first, right? So we want people to not necessarily become Medicare experts unless they really, really want to, because it's not the most exciting topic. We find that most of our clients want to know enough to be dangerous, want to know enough to feel empowered to make a decision and really know what's going on. We'll go deep if people want to go deep. We're happy to do it, but we want to start with simple terms. But this newsletter does a good job of really serving up relevant information, mostly to Medicare. There's some ancillary topics in there as well that are sort of adjacent. But if people are not on Medicare yet, let's say it's a 64-year-old, there's actually some custom information or some extra information that they might get through this process that is, okay, you're turning 64 now, you're a year away from that eligibility. Here's the things you want to be thinking about. Here's some things to consider, some information to digest. Or, somebody that's still not on Medicare, but they're past 65, same thing. All right, working past 65 considerations. Have you compared your employer plan to Medicare? Really kind of posing these scenarios where we can help while giving, general Medicare facts, Medicare news, like when the Part B premium is finalized, that's a piece of content that will be in here. So I do encourage people to join that. We also do educational webinars for the public. So a lot of them are for private groups like this. We also do them for the public. We do one about once a week, usually, on rotating topics, whether it's retirement prior to Medicare age, turning 65, working past 65, annual enrollment period considerations, kind of a little bit more of everything I just went into on this presentation. We do, like I said, some of those are live, but we also keep a library of our recorded ones that can be found there at retiremed.com/webinars. And then my final slide here with this QR code. This is a way to just opt into that email newsletter that I was talking about before. So retiremed.com/B6 is what this QR code would take you to. It has a couple options. If somebody's wanting to talk to somebody right away, there's a phone number or a schedule a call option for us to call you. Otherwise, if you scroll down on that page, for anybody scanning this right now, there is just a form fill. It'll ask your name, your date of birth, because again, some of this can be time released. It'll ask your zip code because plans are offered by county. So that's why we ask for that information. And then in your email, of course, for delivery of this newsletter, that form, submitting it through our site is what will get you sort of enrolled in that newsletter and able to start getting that content from us. So definitely encourage people to do that, whether they want to get deeper and work further with us or not, just again, because it's good information along the way.
So this is a great resource. And again, to scan this, if you're at home, pull out your camera and act like you're getting ready to take a picture, and hovering the picture then over this square, that will then provide the link then that you can click on then to get more information and to enter information then to be able to connect with retirement.
Mm-hmm. Certainly. And if that's too hard, there's the web address there, retiremed.com/B6. Those can be finicky. I mean, myself included, I sit there and click sometimes when I'm using the camera and it's like, why isn't this opening?
Whether it's sometimes the health driven may be part of the reason for change for considering a plan. Is there anything just in general as far as Medicare and behind the scenes, some of the changes of coverage and things sometimes that occur that maybe people just aren't aware of? I guess, how often does it make sense then to really in-depth review and make sure that you've got the right plan?
Great question. So when we communicate to our current clients, when we put somebody on a plan, whether it's initially their first time on Medicare or they switch to a different plan through us, we feel, because our agents are so heavily trained, so heavily on staying up to date with this information, we feel that we're doing the absolute best job we can to get somebody on a plan that's going to continue to be right for them. But unforeseen things can happen. And so they could be insignificant. It could be, one of your doctors, maybe it's your dermatologist. If you're on a plan, like an Advantage plan with a network, maybe your dermatologist decides they're not going to take that carrier anymore. It's rare. We've seen so much more stability with these networks, but it can happen. So it's worth it, in our opinion, to at least just double check the network status of doctors and the coverage levels of prescriptions. It's so easy for us to do. It's a pretty painless conversation. Health needs, they certainly can play a factor, as you mentioned. It doesn't mean you have to change your plan, but it might mean that, hey, I know I'm going to start using this service more. I'm going to start seeing more specialists. Maybe it's looking at a plan that has a lower specialist copay associated with it, or maybe somebody can't drive anymore and they need to find a plan that has transportation benefits if they don't have a caregiver to provide that to get them to doctor's visits or pharmacies or fitness locations or other approved scenarios. It really could be a myriad of reasons. And even if somebody stayed completely the same and their network still works on their current plan, the copays could have just changed and they could be able to find a more cost-effective route for their potential Medicare services, potential prescriptions through a different carrier, through a different plan, or what have you. So it's really under the heading of do your due diligence. Like I said, worst case scenario, or kind of best case scenario, we say, hey, you're already in the right spot. We wouldn't feel good if we changed you to anything, but the alternative is, I'm so glad you called because we think you're going to be able to save this amount of money or get this other benefit for the coming year.
That's great. Well, Gordon, thank you so much for the time and all the resources and information that you shared with our clients today. And again, if you'd like to reach out to RetireMed, here's their contact information. If you'd like to speak with a wealth advisor here at HCM, we can get you in touch with Gordon and their team as well. So again, thank you so much, Gordon. Thank you, clients, for being involved in our webinar today. And if there's something that we can help you with specifically, please reach out to your HCM wealth advisor. They would be glad to connect you with RetireMed, talk to you about your current plan or circumstances. And if there's a family member or friend that we can help, whether it's helping us or somebody that needs Medicare help from RetireMed and someone like Gordon, please don't hesitate to reach out to them or us, and we're glad to provide an introduction. And again, if there's somebody you'd like to introduce to us, we would be honored with that as well. So thank you so much for participating and being a part of this webinar today. And Gordon, thank you again so much.
Thanks so much for having me, Casey, and HCM and everybody that joined. Thanks for listening, and we look forward to helping whoever we can.
All right. Have a great evening, everyone.